Today we are going to talk about some common health hazards for the elderly people, say about after 65. Our social status, social lifestyle has changed. Previously, there used to be joint families in which elderly people used to be taken care by so many family members. They had time to sit and talk. These days, the families are become nuclear families, and the elderly people don't get attention of their near and dear, and they feel loneliness, and this loneliness result back to a depression. Depression is added by loneliness plus by his inability to work day-to-day work what he was doing. At this age, he is not earning. He is lying down. He is unable to walk actively. So this also adds to his depression. So depression has become in elderly people a common problem these days. This need little care by the family members. Giving some time and sitting with them can boost their health. And the person after this age should have some mobility. Without mobility, he will have some problem of gaining weight also and other problems which he may be having already, like diabetes, heart problem or respiratory problems. These will also be aggravated. So elderly people should have, number one, social contact with the family members, which is most important, which doesn't come out of these people automatically or frankly, but it do affect their health, and with that health his other health problems get aggravated. This contributes a lot for the good health or bad health of elderly people. So please take care of this thing. Gaining weight further adds to his other problems of the health issues which he might be having in younger age. Elderly people don't have any earning also. They don't have a zeal to work as they used to do it because of incapability of physical work. So these things are the major issues for the elderly people. This is part 1. In second part, I'll tell you one thing. Old people are more prone to the infections. Influenza, say. Flu is very common. And this flu is due to their immunity has gone down. Their capability to walk has reduced. So lying down every time. Change of weather also contributed. And then one gets lungs problem, cough, difficulty in respiration, and that can lead to pneumonia and so many other problems. And ultimately these days we are finding a good number of elderly people suffering with pneumonia and lung related diseases, which become difficult to be treated with the little moving patients or heavy patients. After that, another thing comes due to lack of this reducing of immunity, other diseases also catch up. Kidney problem can be there. Urine flow, prostate problem is there. Urine is not passed regularly or frequently, so become difficult. And these diseases contribute to already he may be having a little bit heart related problem or high blood pressure. Then taking medicine every time also contribute to his depression. So these things are to be taken care to be a very good. Those people who move, who have regular lifestyle, sitting with their friends, spending time here and there, they are much better. Sometimes you can find a person of 65, an old person, and a person of 80 may look young. It is due to their lifestyle and their personal lifestyle. For the elderly people to be happy and healthy, I will advise only one thing, that one should be moving all the time, not always lying down, and do whatsoever he feel like, eat whatsoever he wish. Naturally, according to the doctor advice, if something is not good for you, say sweets are not allowed for the diabetic, that is to be avoided. And one should laugh daily on anything. On yourself also laughing is good. So be happy, be healthy. Don't think that you are going old. You are getting mature. much mature, much better gained person. So please have a positive thinking, and I know any elderly people can enjoy if he changes his lifestyle. This is my advice. There is a saying, prevention is better than cure. The once baby is born, we start vaccinations right from that time. And it goes on. Everybody knows that babies are to be vaccinated. Now it is also said, elderly people are also like babies. These days, regular vaccination for elderly people has also become must. Pneumococcal vaccination is there, one shot in 3 years or 5 years. Another is for influenza vaccination. Every year is to be done. In the last quarter of the year, it is always a new vaccine comes for influenza with the latest type of these viruses. So every year in the last quarter of the year, elderly people, elderly means not old, I mean more mature people should get vaccination done every year for flu. This is recommended. It is important. Right knowledge is a right health. If you like this video, please subscribe for more such good videos.